54-year-old woman sat down in a hospital chair in the English Midlands and was told that the whitish patch inside her left eye was not a scar and not some leftover mark from old inflammation. It was an organism, a single cell, and it had spent months eating its way through her cornea. Marie Mason had never set foot in a rainforest, never swum in a polluted lake. The thing that did this came out of her own showerhead, the one in her own bathroom, one she had used every single night for 2 years with her contact lenses still in. Her case hit the international headlines again when a CNN alert warned that more than 23,000 cases of this same infection are logged every year across the 20 countries that even bother to count them. The organism behind it has a name, lives in roughly 1 in 10 household taps, tested in cities across the developed world. Almost nobody who wears contact lenses has ever heard of it. Before this video is over, you're going to understand 3 things. First, why the corticosteroid drops a specialist prescribed in perfectly good faith worked in clinical terms, like fertilizer for the parasite. Second, the exact amount of contaminated tap water sitting in British and American homes right now. Third, the surgery Marie finally went through, why it failed, and what she carries today in the cavity where her left eye used to be. Click away before you get to the third one, and you'll miss the part the contact lens industry has spent 2 decades quietly keeping off the box. Stay to understand how a microscopic creature ended up tunneling through Marie's cornea. We have to go back 2 years, to the night she stepped into the shower without a single thought of taking her lenses out, and the hot water started to fall. 2 years before that hospital chair, Marie was a 54-year-old administrator in a small town in the English Midlands. She had a husband, grown daughter, and a granddaughter who came to her house every Sunday. She kept a small camera on the kitchen windowsill and, every Sunday afternoon without fail, took one photograph of the child in the back garden. Guard this detail. The Sunday photograph. It will come back. She had worn soft, monthly lenses since she was 31, 23 years of the same routine. Open the blister pack on the first of the month, drop the lens into the case at night, top up the solution, sleep, repeat. She had never, all that time, had an eye infection, not one. The bathroom in her house was small and tiled in pale green. Water came from a cold water storage tank in the loft, the way water still comes into millions of British homes, sitting in a plastic cistern, under the rafters, warming and cooling with the seasons, feeding the taps and the shower head through pipework laid down decades ago. According to a study published out of a Hong Kong public health laboratory, around 10% of domestic tap samples in cities like hers carry the organism we are about to name. In homes served by a roof tank, the rate is higher. In older properties, higher still. Marie's house was older. Marie's house had a tank. She did not know any of this. Picture the scene. A Tuesday evening in autumn, Marie steps into the shower with her contact lenses in, the way she has done for years. Water hits her face. She rinses her eyes open under the stream. Because soap has run down her forehead and she wants to clear it, she tilts her chin up. The water sluices across both lenses. It feels as it has always felt, like nothing at all. Her sister, who lives in the next town over, has worn lenses for almost as long. Her sister has a rule. The lenses come out before the bathroom door closes. Every night, no exceptions. Marie has teased her about it for years. Guard this detail too. The sister with the rule. That Tuesday night, on the curved surface of Marie's left lens, a microscopic cyst drifted out of the shower head, rode the stream of water, and stuck. It was double-walled, dormant, the size of a single human red blood cell. It was completely invisible. It was already alive. She did not see the small print on the side of the lens packaging, the line that warns against any contact with water. Quiz 100 contact lens wearers on a busy street, and by all available accounts, fewer than 10 can quote that line. Marie could not have quoted it either. She finished the shower. She toweled off. She put the lens case on the edge of the sink, dropped both lenses in, topped up the solution from yesterday rather than replacing it cleanly, and went to bed. Maybe you do it too. Maybe you've showered 1,000 times without a second thought. I am asking you to sit with that for 1 second. For the next several weeks, nothing happened. Then the first symptom arrived, and it did not look like what was actually wrong. Day 42. Marie woke up with a grain of something in her left eye. She rubbed it, rinsed at the bathroom sink, and the grit stayed. The end of the day, it felt less like grit and more like a thumbtack pressed against the inside of her upper lid. She told her husband. He looked. He saw a slightly red eye and nothing else. She slept without the lens, and in the morning it felt almost normal. Day 56. Same eye, same sensation. This time it did not fade. Marie booked an appointment at the high street optometrist she had used for 15 years. He looked into the slit lamp, saw mild redness, a slightly cloudy patch on the surface, made the diagnosis any optometrist would have made on those findings. Bacterial conjunctivitis. Antibacterial drops, 4 times a day for a week. Drops worked for about 48 hours. Then the pain came back worse. Here is the first thing I promised you at the start. Single question Marie's first 3 doctors never asked. Not the optometrist, not the GP, not the specialist who came later. Nobody said, "Do you ever shower or swim with your contact lenses in?" Nobody asked. And without that question, the correct diagnosis was, statistically speaking, possible. On day 70, Marie's GP took a second look. The eye was now visibly inflamed. Pain was disproportionate to anything he could see, and pain out of proportion to findings is, in the corneal literature, single most quoted warning sign of the disease she actually had. He did not know that. He upgraded the diagnosis to the next most common explanation: herpes simplex keratitis, the one that, according to multiple cornea review papers, is the most frequent misdiagnosis of this infection. He prescribed antivirals. Because the eye was so inflamed, he added a low-dose corticosteroid drop. Here is the part that should not have happened. The steroid was, in clinical terms, food. Body's immune cells had been the only thing slowing the organism down. The steroid switched them off. The amoebae, in 2 forms, mobile feeding trophozoites and the armored dormant cysts, felt the brake release, and they ate faster. Marie felt better for 3 days. Worse than ever. Day 110. A hospital eye clinic. Junior consultant suspected a stubborn viral keratitis and escalated the steroid dose. He wrote in the discharge note that the patient was responding favorably to treatment. The note did not mention that Marie could no longer read the bottom 3 lines of the chart, did not mention that her left pupil had begun to react sluggishly to light. It did not mention the fine, radial, branching white lines spreading from the center of her cornea outward, like cracks in frozen glass, following the path of her corneal nerves. That pattern has a name: radial keratoneuritis. In the cornea world, it is almost pathognomonic, almost diagnostic on sight, for one organism and one organism only. Nobody in that clinic recognized it. Day 180. Marie could not open her bedroom curtains without screaming. She had not slept properly in weeks. Her husband drove her to the eye emergency at 6 in the morning, and the consultant on duty that day had trained at Moorfields, seen this before, and asked the one question nobody else had thought to ask. The specialist asked whether Marie showered with her lenses in. Marie said yes, every night for years, and then everything fell into place. The specialist didn't look surprised. She looked tired. She turned to the resident standing beside her and said the name out loud, in full, for the record. Acanthamoeba keratitis. Write it down. Acanthamoeba, from the Greek acantha, meaning thorn or spine, and amoeba, meaning change, a spined shapeshifter. Under the microscope, its surface is studded with tiny needle-shaped projections, the acanthae. Keratitis. Kerato, from the Greek for horn, same root that gives us keratin. The suffix itis, inflammation. In plain terms, a spiny, shape-shifting organism is inflaming the clear front layer of the eye. Under the slit lamp, it shows up as radial fissures. Under the microscope, constellation of double-walled cysts packed between the layers of the cornea, like grains of sand pressed into glass. And then there were the trophozoites. Trophe in Greek means nutrition or food, zoion, a living creature. A trophozoite is, literally, a creature that lives to feed. It is the active form of the organism, mobile, hungry, able to secrete enzymes. In Marie's cornea, trophozoites were not abstract figures on an anatomy slide. They were the machinery in motion. Each one crawled forward, ate, divided. The ones that didn't push ahead insisted in tissue already invaded, leaving behind a reserve of dormant forms that no conventional drug could reach. Here is how the process works in 4 steps. First, the organism lives free in water and soil. It eats bacteria. Conditions turn hostile, it shrinks into a cyst, builds a double wall of cellulose around its body, and waits. That cyst can survive freezing, boiling, and most disinfectants. It can sit in a lens case for months and wake the instant fresh solution touches it. Second, soft lenses resting against the cornea ramp up the surface expression of molecules called mannose-elated glycoproteins. Amoeba has receptors that lock onto those sugars like a hand into a glove. The lens creates a perfect anchoring surface. The longer the lens sits on the eye, the more anchor points the cornea produces. Third, once anchored, trophozoite secretes enzymes called metalloproteases that dissolve the structural collagen of the corneal stroma. Amoeba crawls into the gap it has carved, eats deeper, divides, multiplies. A fraction of its offspring insist in the stroma as it advances, leaving a trail of sleeping mines behind it. Fourth, the colony spreads along the path of least resistance, which in the cornea happens to run straight along the corneal nerves. The amoebae wrap around the nerve sheaths and strip the myelin, producing the most extreme eye pain in all of clinical medicine. Pain so out of proportion to anything a doctor can see that it is, on its own, diagnostic clue. Marie's pain had been screaming this diagnosis for 4 months. Nobody had listened. The specialist ordered a corneal scrape, blade, a drop of anesthetic, a thin layer of Marie's corneal surface smeared across a nutrient-free agar plate seeded with Escherichia coli. If the organism was there, it would wake, sense the bacteria, and crawl across the plate to devour them, leaving visible tracks. 48 hours later, the lab called. The specialist listened, said thank you, and hung up. She walked back into the room. Marie was sitting in the chair, her husband holding her hand. The silence lasted exactly as long as it took the specialist to close the door. It is not a virus. It is an amoeba. It is in your cornea. We have to start treatment today. She opened the folder in her hand and began to explain what 4 months of corticosteroid drops prescribed while the colony was already feeding, quietly done to Marie's odds. The contents of the eye were surgically removed. The socket was left empty. A silicone prosthesis, as of the shell, was placed over what remained of the tissue. Before that final moment, there was still one last window. Corneal transplant had worked. If the medications administered every hour for months had managed to eliminate the last cysts lodged in the stroma, Marie would have recovered functional vision. Partial, yes. Scarred probably. But vision instead. Graft began to melt 8 weeks after surgery. The cysts had survived at the margins. The infection returned from inside the donated tissue, as if the parasite had been waiting for exactly that. The moment when the medical guard, exhausted after months of intensive combat, began to drop. Trace the chain backwards because every step depended on the one before it. Step 1, the graft melts. Step 2, cysts hidden at the graft-host junction survive the surgery untouched, cause no scalpel can chase a microscopic spore into healthy-looking tissue. Step 3, The infection reignites inside the donor cornea. Hourly drops that worked the first time no longer hold the line. Step 4. Evisceration. Eye is removed because there is nothing left to save, and leaving it risks worse. 4 steps, 1 outcome. No detours available once step 1 begins. There was a moment when the results looked promising. The doctors recorded improvement. Inflammation receded enough that, for several weeks, both the clinical team and the patient herself believed the worst had passed. A kind of provisional relief is, sometimes, the cruelest chapter in the story. The pause before the definitive collapse. The body mimics a normalcy that the parasite has already decided to cancel. Hold on to this name, even though you don't know it yet. Her sister. The one with a rule. The one who drove Marie to her post-operative appointments. She had been wearing soft contact lenses for 25 years. Same brand, same country, same plumbing with its rooftop water tank, kind that epidemiological studies identify as a vector of domestic colonization. She had never had an infection. She had never let tap water touch a lens. 10 seconds. That is the margin researchers point to when they compare habits between cases, controls in studies of Acanthamoeba keratitis. Roughly the time it takes to remove your lenses before stepping into the shower versus the time it takes not to. Same environmental conditions, different reflex. A completely different life. Marie reads today with her right eye. She misjudges depth going downstairs. She wears a prosthesis over the socket where her left eye used to be. She still showers, still lives, still appears in the Sunday photographs with the tilt of the head her granddaughter has learned to imitate without realizing it, as if it were simply grandma's favorite angle. And in data compiled from just 20 countries over a single calendar year, more than 23,000 people are living some version of this same story. Most of them don't know the name of the organism that infected them. Many of them, at this very moment, are being treated for viral conjunctivitis. The question even the specialists still cannot fully answer is why some people with the same risk factors, the same lenses, the same tap, same parasite in the case, never develop a single symptom, while others lose everything. The CDC, in a multinational survey across 20 countries, put the figure at more than 23,000 cases worldwide every year. The United Kingdom alone records between 150 and 200 each year. According to John Dart, the UCL Institute of Ophthalmology, nearly half of those patients suffer substantial vision loss. A handful every year lose the eye entirely. There is only one rule, the only one you need. Never let tap water touch your contact lenses, not in the shower, not at the sink, not in a glass on the nightstand because you ran out of solution, not in a pool, not in a hot tub, not on a wet finger. If you take nothing else from this video, take that. In the first scene of this video, Marie was sitting in a hospital chair being told there was something alive inside her eye. Tonight, somewhere in the English Midlands, she is standing in front of the bathroom mirror. She holds the little case in her right hand. She takes out her right lens before her other hand ever reaches the tap. The shower runs behind her. She doesn't look at it. The organism that stole her eye was already in the pipe behind the wall. Studies of asymptomatic wearers in the United Kingdom, Canada and New Zealand found Acanthamoeba in up to 8% of lens cases. Contamination is not the exception. It is the baseline. Separates a contaminated case from an eviscerated eye is, almost entirely, behavior. Marie's eye was not taken by bad luck, tropical pathogen, or some freak one-off accident. It was taken by a routine, hers, ours, almost everyone's, and by the silence around a single line printed on the side of a lens box that almost nobody reads. The amoeba is still in the pipe. The pipes are still in the wall. The wall is in millions of homes. The only variable left is you. 10 seconds between your contact lens and the tap. This is shocking medical cases.